All right, so let's move into three delegation errors in this cardiac arrest scenario. First, switching of compressors. With regard to the compressor not pushing deep enough and moving too fast with their compressions, that's obviously a teaching moment. The intensivist could have told the nurse to slow down their compressions and to push a little bit deeper as opposed to just automatically having them swap out with the other nurse. That's something that could have been easily fixed. I feel like an opportune moment for education was right there and available. And the only time I feel that the intensivist should have maybe swapped out the nurse, it would have been if you saw that they were being fatigued, but then you could have given feedback and said, hey, you look like you're getting tired. You should switch out with the other nurse. But switching out the compressor wasn't a good issue regarding the task that was delegated. Ensuring that the historian and the recorder would let them know ahead of time when 2 minutes of compressions would be approaching. Even though, as I already said before, I talked about ACLS and BLS and knowing your roles and whatnot, with the historian, it's important the intensivist tells the historian or the recorder, let me know when 3 minutes have passed and next epi is due, or when 3 minutes are approaching. Let me know when 2 minutes are approaching, and we can do a pulse check. It's important to ensure that person knows when to let you know that information, because they have a very important job. And last, of all the people I told you that were assisting with the help of the code, the intensivist did not delegate anything to the PCT. There are certain things that the PCT can do. They can do chest compressions. They can attach leads. They can get the EKG machine. They can put on the pads. And when you have a PCT there, you also have nurses that are at a higher level, and they could do more things during their license. You may risk under-delegating and having the nurses do tasks that would a PCT would be able to do, and that would be more appropriate for the situation. So lastly, let's talk about a healthy work environment. And first, we'll define exactly what a healthy work environment is. A healthy work environment is a work environment that is safe, empowering, as well as satisfying. And so now we're going to look at the 6 essential standards of a healthy work environment. And let's see, the first one would be skilled communication. This is where the nurses must be as proficient in communication skills as they are with their clinical skills. True collaboration, which is the nurses must be relentless in pursuing and fostering true collaboration. Effective decision making, where the nurses must be valued and committed partners in making policy, directing, evaluating clinical care, and leading the organization's operations. Then we have appropriate staffing, which is where staffing must ensure that the effective match between patient needs and the nurse's competencies are met. A meaningful recognition, where nurses must be recognized and must recognize others for the value that each member brings to the work of the organization. And lastly, authentic leadership, where the nurse leaders are fully embracing the imperative of a healthy work environment, and they're authentically living it as well as engaging its staff members in its achievements. And now I want to discuss how I feel about my work environment, whether I feel like it's a healthy environment based on these 6 essential standards. So let's take a quick step back. With skilled communication, our nurses are very proficient in their communication skills, and we often get our voices heard through unit council meetings. With collaboration, we're constantly striving to work with our intensivists, our managers, and our directors to collaborate on changes we feel are appropriate for our ICUs. With effective decision making, our nurse practitioner, who is an intensivist, the one that we have in the evenings, they actually develop many of our ICU's policies, and this is with the collaboration and expert opinions of professionals in the medical field and their respective fields. So we discuss changes to unit policy at our unit council meetings, as well as our staff meetings, and all of our ICU managers, our ICU nurse educator, as well as our director, president of all those meetings. As far as appropriate staffing, now this can be an issue almost at any hospital, but we are not always staffed effectively in some of our ICUs. We oftentimes have assignments where ICU nurses have 3 patients, and that can be due to call-outs and sometimes having patients like unexpected things like one-to-one patients coming up to the floor, like a patient that needs an Impella CRT, a patient that's receiving TPA for a thrombolytic stroke, a patient that's getting targeted temperature management because they were post-cardiac arrest, things of that nature, some things that you can't foresee in the ICU. And some of this is also due to having to abide by a matrix, and that'll oftentimes send our nurses to the floor to work in areas that they're honestly not that familiar with, and sometimes sending nurses home or putting some nurses on call, because according to staffing matrices, doesn't look at acuity of patients and things of that nature. It just says you have this many patients at this given moment in time, you need this amount of nurses, and anything else is overstaffed. We do, however, try to combat that often with critical need pay, which is an incentive, paying nurses more on special days where we really need staff members, and we're always offering extra shifts, so there's always overtime, and overtime may be made. As far as meaningful recognition, we are all at my facility really excited to be getting these jackets, because we actually made it as far as being awarded the unit of distinction in all of the hospitals in our unit. But I'll talk more into that in a little bit. So meaningful recognition, we recognize our nurses with the DAISY Award, or the patients do. We recognize our own staff members by giving shout-outs on them, and you can see those on the bulletin boards. We'll do those during staff meetings, and we have a private ICU Facebook group where we often commend individuals for what they've done. As far as authentic leadership, our managers do embrace and push for a healthy work environment, and they actively engage us in our achievements. Like I said, our unit got the Unit of Distinction Award for 2017, so we're going to get some specially made jackets. We got these pins, and then we got like this, this giant thing posted on the wall that shows using the distinction in our ICU. And our ICU is actually ranked number 4 out of all of the HCA hospitals, so that's really good. And they our leaders are very authentic, and they do want us to embrace like the growth of our unit and our hospital as a whole. So it's very good. And so overall, with that, I would say that I do work in a healthy work environment. So how can an effective leader create a healthy work environment? Well, easier said than done, but by actively embodying the 6 essential standards of a healthy work environment. Carrying out skilled communication, collaborating with others, being an effective decision maker, staffing your staff appropriately when possible, and discussing with them why they're staffed in a particular way if you can't make the staffing better, showing meaningful recognition to your staff, and being an authentic leader. So overall, we discussed conflict, delegation, and how to develop a healthy work environment, and I want to thank you for listening to my presentation. And here are the references I used. Thank you.